People often feel that the goal of psychotherapy is to feel better. I think the actual secret, at least in the form of therapy that I employ in the work I do with people, is to try and not feel better. It's kind of shocking when you think about it, but I think our efforts to try and feel better, to modify what we're experiencing privately, internally, to modify our thinking, our efforts to try and change how we feel, are actually at the root of our suffering. They actually create the problems that people come in with that they've been experiencing for years. So when essentially you try and get rid of something, it stays. When you learn to accept and tolerate it, and maybe work through it differently, or become at least more okay with it, or change your relationship to it, I think you've done a much better service to yourself than trying to fight the reality. If you're struggling with something that is related to rumination or perfectionism, or you do some sort of compulsive behavior such as washing your hands, or another behavioral addiction such as drinking or excessive drug use, all these things are forms of experiential avoidance. All these things temporarily relieve people of their suffering, but in the long term they actually teach people that they can't endure the challenges that come up in life. They also teach people not to accept reality. They teach people that reality is something that needs to be modified or changed. And I feel my job is to help people give up a lot of unhelpful ways of thinking and doing, and live in a way that's more in line with how they prefer to be, in a way that will actually give them a reduction in physiological and psychological distress.